Do you look at your toes and think, man, these are getting crooked? Or do you have a grandma that has really crooked toes and you're afraid that yours might look like them? Well, if you have toes that look like little hammers, or they tend to look like little claws, then you may have hammer toes. But there's actually a couple of different kinds of hammer toes. There's flexible hammer toes, which means that my toes make little claws when I'm running, jumping, and playing with the other kids. And maybe I've got some little red bumps on the top of them because they rub in my shoe. But when you look at them, they actually look pretty straight because they're flexible, meaning that I can make them straight. Then there's semi-rigid and rigid hammer toes, which are kind of almost stuck that way. Now those kind of hammer toes are really hard to miss. They're crooked all the time. They usually have corns and calluses on top of them, or little tiny calluses at the tips of your toes, because they're curling to grab the ground and trying to stabilize your foot. That stabilization over a period of time causes them to be rigid. Once they're rigid, guess what? The only thing we can do is surgically fix them. Don't listen to anybody who says they can just tear a tendon, pop a little device in your shoe, and your hammer toes are going to voila, go away, because they're not. But reality is that a little tiny hammer toe procedure that is much simpler than we've ever done before can fix the problem, and then we put a device in your shoe that fixes the biomechanics, the reason that your toes are curling to grab the ground, and voila, you have normal toes. So if you have hammer toes, or if your grandma has hammer toes and you want to prevent them, then come on in, we'll take a look at your biomechanics, take a look at the underlying problem as well as the structural deformity, and see what we can do to fix your problem.